taking your calls about those barristers. I suspect that is a topic we might well come back to on my show this Sunday afternoon as well. But I also want to talk to you this hour about junior doctors who are next month due to go on strike for 4 days straight. From the morning of Tuesday, the 11th of April, to the morning of Saturday, the 15th of April, thousands upon thousands of them will refuse to turn up to work. And, of course, this walkout, like the others, will bring fresh chaos to the NHS. Some estimates suggesting that up to 250,000 appointments will be cancelled as a result of this strike. Now, in order to avert that industrial action, junior doctors are demanding a 35% pay rise. They say that that is what they are owed because of cuts to their pay that have taken place since 2010. Now, clearly that's a huge figure. The government and the Health Secretary, Steve Barclay, say it is absolutely unrealistic, it's unfeasible, and it isn't going to happen, but they are happy to continue to discuss what might work. Now, even Labour this morning came out and said it doesn't support this strike. And I wonder if that makes you think that actually the junior doctors on this one have got it wrong. That if even Labour is saying, look, come on, these demands are unrealistic, that is a sign that this strike action is not warranted, at least with the demands that the doctors are currently making. Or do you think that actually it's not a reflection on the junior doctors or what they're asking for, but a reflection on Labour and what it stands for, indeed doesn't stand for, under Keir Starmer's leadership? 03456060973. Wes Streeting, the Shadow Health Secretary, was asked about this by Nick Ferrari here on LBC this morning.
No, I don't support the strike action, Nick. I don't want the strikes to go ahead. I do think the junior doctors are making a fair argument around their pay and the fact that pay has not kept up with inflation. I've spent a lot of time on the front line talking to junior doctors, and to be honest, I always feel quite sad when I've spoken to junior doctors, because they are a bunch of professionals at the start of their career in the NHS, really. They should be full of energy, they should be full of optimism about their future careers, and they are feeling burned out, undervalued, and they are feeling a financial pressure, especially if they're working in big cities. So I don't think they're being unfair or unreasonable. I think that the headline pay demand they're making, I don't think is achievable overnight, and I've been honest with them about that. But I don't want to see the strikes happen. I want to see the government come to a compromise so that the strikes do not need to go ahead.
Wes Streeting there saying he doesn't think that pay demand is unreasonable, but he also doesn't support the strike. That's the same Wes Streeting you might remember who previously described the British Medical Association, which represents junior doctors, as a vested interest group. Is his lack of support for this strike a sign of Labour's failure as the party of the workers to stand alongside low-paid workers, or a reflection on the fact that junior doctors have gone too far and are asking for way too much when they talk about a 35% hike? 03456060973, the number to call. Text 84850. Tweet me at LBC. Dr. Layla McCay is Director of Policy at the NHS Confederation and says talks need to resume in order to resolve this issue.
Well, it's absolutely the case that junior doctors have assessed what the situation is, where their pay's been going, the cost of living situation, and have made a call. But I think that what we really need is that junior doctors do get together with government and have discussions about how to take this forward. At the moment, I think health leaders would have hoped that there had been a bit more progress that had been made on those discussions, and it's frustrating that that's not the case. To see that there's about to be this really significant strike coming up, and the timing just after Easter to cause really significant disruption, is just a huge blow to efforts to tackle the backlogs, efforts to provide safe and efficient care. I think that everybody's really feeling quite anxious about that at the moment.
Just tell us a bit more about that. How difficult will this strike be for the NHS as a whole? What kind of impact is it likely to have?
Well, first of all, there's going to be a significant impact on elective procedures and other appointments that are due around that time. There's always a bit of disruption around Easter, but what we're going to see now is that extending on. Last time we saw about 175,000 appointments and procedures being cancelled. That was more than all the other strikes we've seen recently put together. And our members tell us it's likely that there will be even more. There could be up to 250,000.
250,000 cancelled appointments just in those 4 days alone.
There could be. Obviously, we don't know the specific figures, but that is a concern. So certainly that's one big stress. Another stress is, of course, how to make sure that their absences are safely and appropriately covered. As you know, in the last strikes, there was quite a lot of goodwill by consultants and others, pharmacists, anyone else who was able to provide some type of cover. But around Easter time, quite a lot of these people already have annual leave booked, and quite a lot of them who were involved last time might be less able to provide that cover on this occasion. So certainly our members are looking at that right now and are feeling quite concerned that there might be less capacity to provide the cover that's needed.
Just to be clear on what that means, does that mean that even emergency care, even really time-sensitive areas like cancer treatment could be affected in a way that they haven't been as much previously?
Well, the industrial action, from as I understand it, will affect all areas across care. However, obviously, healthcare leaders will be planning rigorously to make sure that the most urgent cases are supported as much as possible. Obviously, a lot of prioritisation will have to be done, and as ever, the NHS prioritises based on patient safety and urgency.
You said a moment ago that you were frustrated that more progress hadn't been made in talks. Is your sense that the failure to reach any sort of positive outcome so far is because the junior doctors won't compromise enough, or the government won't compromise enough?
Well, as ever in discussions like this, it's really incumbent on both sides to figure out how to find compromises to get to the table and have meaningful discussions. So really just digging in and dragging this out isn't going to do anyone any favours. There needs to be some movement on both sides in order to get around the table and have those discussions.
So both are guilty of digging in and dragging it out, in your view?
Well, it's hard to say, but at the moment there certainly seems to be a stalemate.
Mm. And just finally, the prospect or otherwise of a 35% pay rise, what would your members have to say about the likelihood and the realistic prospect of that?
Well, it's very hard to know. Obviously, we've seen some of the other industrial actions being addressed in different ways that have looked at rises that are not to that extent. But it's certainly not for me to say what might be agreed. That's between the junior doctors and the government.
Dr. Layla McCay there, the Director of Policy at the NHS.